All right, let's dive straight into this really fascinating exploration of the human lungs. Today we're going to uncover a brilliant, hidden architectural secret sitting right inside our chests. You know, when we think about breathing, we usually just picture two large balloons inflating and deflating. But the reality of our anatomy, it is so much more sophisticated. It's intricately engineered and, honestly, beautifully designed. So welcome to today's Explainer, where we are fully unpacking the incredible architecture of bronchopulmonary segments. To set the stage here, I want you to picture a pretty high-stakes scenario. A surgeon needs to remove localized lung disease from a patient. Let's say it's a stubborn case of tuberculosis, a really severe localized infection, or even a benign tumor. So how exactly do they do this without, removing or destroying the patient's entire lung? How on earth do they know exactly what to cut to save the healthy, life-saving tissue while completely getting rid of the diseased part?
Well, to answer that, we are going to take a logical journey right into the chest cavity. We'll start with the lungs' modular design, follow the air down the bronchial tree, define what a segment actually is, map them out, look at a really cool twist with the veins, and finally connect all of this to conservation lung surgery.
Okay, Section 1. The lungs' modular design. We so often think of our lungs as just two giant, simple sponges. But actually, scratch that. That idea completely misses the most mind-blowing part of their design. If we treat the lung like a high-rise apartment building, the major lobes, there are 3 on the right and 2 on the left, are kind of like the different wings of that building. But what we're looking for today are not those massive wings. We are looking for the individual, self-sustaining apartments inside them. The lungs are modular. They are built out of smaller, perfectly defined, independent units.
Moving on to Section 2. Down the bronchial tree.
To find these individual apartment units, we have to travel macro to micro. We have to follow the path of the air. Imagine you're looking straight down the windpipe, or trachea. You eventually hit this keel-like median ridge right in the center where the main airway splits left and right. This split is called the carina. Quick aside here, the anatomy text notes that the mucosa at this specific spot is incredibly sensitive. It's actually where our cough reflex is heavily initiated to clear out sputum. But for our anatomical journey, this is the grand fork in the road. From that initial split at the carina, the air travels down the principal bronchi. The right one is actually a bit shorter, wider, and more vertical, while the left is longer and more horizontal. From there, the airways branch out into the lobar bronchi, which supply each major lobe. But it doesn't stop there. They split yet again into the tertiary or segmental bronchi. And this branching, it brings us exactly where we need to be.
Which brings us to Section 3, defining the segment.
So here is the absolutely crucial takeaway. A bronchopulmonary segment is a completely independent functional unit of the lung. It is a very well-defined wedge-shaped sector that gets all its air from its very own dedicated tertiary bronchus. It's not just some random chunk of tissue. It is a highly specific, engineered compartment.
Think of these segments like 3D pyramids. They've got their points, or apices, facing inward toward the root of the lung, the hilum, which is where all the tubes enter. Their flat bases then sit all the way out on the lung's outer surface, just beneath the pleura. You can almost imagine how they sit side by side, totally distinct and separate from one another.
Each one of these little pyramids acts like an isolated fortress. First off, each segment is totally wrapped in its own connective tissue. It literally has its own walls. Inside those walls, it has its own dedicated air conditioning, which is that tertiary bronchus we just talked about. But get this, it also has its own dedicated blood supply. A specific branch of the pulmonary artery dives right into each segment, alongside the bronchus, bringing in deoxygenated blood. It even has its own independent lymphatic and nerve supply, the whole shebang.
All right, Section 4. Mapping the 10 segments.
Because these segments are so clearly defined, anatomists have actually mapped them out perfectly. Both the right and left lungs are neatly divided into exactly 10 specific named segments. For instance, in the right upper lobe, you've got the apical, posterior, and anterior segments. The left lung has 10 as well, they're just distributed a little differently, with unique names like the superior and inferior lingular segments. And every single one of them matches up perfectly with its own specific segmental bronchus.
When you look at how the bases of these pyramids hit the lung surface, it all comes together. These 10 distinct, individually wrapped, internally supplied segments create the complete, familiar shape of the lung. When you pack them all together, they interlock. It's literally like a perfectly packed 3D puzzle.
Now for Section 5, the veins on the outside.
Okay, so here is a major architectural twist, and it's vital.
We just established that the bronchus delivering air and the artery delivering blood dive right into the dead center of each pyramidal segment. They run side by side. Usually in the human body, veins travel right alongside arteries, but not here. The pulmonary veins, which drain the freshly oxygenated blood back to the heart, do not accompany those arteries. Instead, they run on the outside. They travel right along those connective tissue borders between the segments. The veins are literally the borders between the puzzle pieces.
And finally, Section 6, Conservation Lung Surgery.
Let's see how this incredible plumbing layout makes modern surgical miracles possible. Remember that high-stakes question from the beginning? How does a surgeon remove the disease without taking the whole lung? Well, this is the secret. Because the pulmonary veins so clearly mark the outer boundaries, and because each segment is functionally independent, a surgeon can carefully slice right along those outer connective tissue planes. By following the veins, they can isolate and remove just one single diseased wedge.
As the source material so perfectly states, doctors can exploit this modular design to cure localized diseases. If a patient has a tumor restricted to just one segment, the surgeon simply unplugs that one compartment. They tie off its specific artery and bronchus, slide it out, and conserve all the rest of the healthy lung tissue so the patient can go right back to breathing normally. I mean, it is a true anatomical masterpiece.
So the very next time you take a deep breath, just take a second to appreciate the 20 independent little apartments inflating and deflating inside your chest, doing their job perfectly walled off from one another. It's such an elegant solution. And it kind of makes you wonder, if our lungs are built like modular 3D puzzles, what other organs in the human body hide a secretly compartmentalized design? Definitely something to keep in mind as you continue exploring the wonders of human anatomy.